absolutely wonderful that you took the time and the energy and the effort to come up here to Washington. And I think Washington's got a great day for you, especially under a tent, because it's mighty hot out there. But I think what you're here for is probably one of the, well, it is, I think, the most important thing going on in our country today. And that is how we can, as I truly think that the most important nation in the world, we've got to figure out a way to be sure that we have an ability to cover every American with affordable health care. And we've got to be sure that people with pre-existing conditions will be able to either qualify or be able to buy insurance that they can afford. And I tell you, I've been working day in and day out on this committee. It's called the Health, Education, Labor, and Pensions Committee. I sit on that committee. There's actually two committees within the Senate that's looking at this. One's the Finance Committee, and the other is the Health, Education, Labor, and Pensions Committee. And I think all of you know that Senator Teddy Kennedy is obviously, we've got him in our thoughts and prayers daily, recovering from brain cancer. So he is not able to chair the meeting, but we've got a very able senator, Senator Chris Dodd from Connecticut, who's taken over. But it is, there's a lot of moving parts to the health care legislation. And we're working on about 5 of those different areas within this committee. We're looking at prevention and wellness. I believe right now we've got about $10 billion a year going into a fund that's really going to be concentrating on prevention and wellness. And what I've always said is we in America, we've got to do a better job at keeping care of ourselves. So a lot of it's our responsibility. We've got to do that through eating right and exercising right and not smoking and all those other things that we know about. But we've also got to be sure that we pass that on to our children. But anyway, prevention and wellness is a big aspect. The other one is workforce coverage. We've got to be sure once we get a system like this in place that there's the physicians available and the nurses and the technicians that are going to be able to treat all of those 47 million people who are currently uninsured now. Once they actually go to facilities, that they can find treatment. So there's a big component of what we're doing right now on workforce, being sure we have the capability. The other one is actually the coverage. How is this going to be modeled? And you've heard, and I know a lot of you here are talking about the public plan. I don't really care what we call it, as long as it works and as long as it does what's right for the pre-existing conditions, affordability, accessibility, and to be sure that you get the treatment that you need. The other idea is fraud and abuse. We've got to be sure that fraud and abuse, we know that we can save billions of dollars if we're certain that we can get not certain, that we've got to get the fraud and the abuse out of the system. So those are a lot of the components that we're working on right now. I know how important this is. I know how important this is to each and every one of you out here because, I mean, you're by being here, you're speaking volumes. But I also know how important it is to everybody in North Carolina and in our country. So that's what we're working on, and I truly appreciate you coming here. And I also will say I'm very pleased to be in the U.S. Senate, and without each and every one of you here, I probably wouldn't be here today. The other thing that I'm sitting in on morning, noon, and night is the what's called the Senate Armed Services Committee, and we're looking right now at the budgets going forward for the next couple of years, and I know how important the military is in North Carolina. And I just think we ought to applaud everything that our men and women in the armed forces do for each and every one of us. And we're trying to uphold to be sure they have the right equipment and tools in order to keep safe and protect our country. So, thank you very, very much. And once again, I appreciate you being here. I've got 2 minutes.
Senator Hagan, on behalf of North Carolina Healthcare for America Now campaign, folks asked me earlier if you were going to show up, if we could ask you just a quick question about the HCAN principles. These are the core principles of our campaign. Do you support affordable health care coverage for all Americans? Do you support... Yes. Excuse me, I'll speak up. you saying I should give her the microphone?
Yes, I support affordable health care coverage for everyone.
Do you support health care benefits for all Americans that give them the real health care coverage they need? Benefits which is sufficiently comprehensive that it takes care of their real health care needs and concerns?
I think that's the same as the first question. I mean, I think that affordable health care coverage, what it is, if you have epilepsy that you can be treated, if you have cancer that you can be treated, the illnesses that you present, I mean, you definitely, in this country, ought to have a way to be treated. Yeah. How about a question back there? Somebody back there had a question.
He's right there.
Right there.
Okay, let's put it back to him. We asked him that.
Let me get through these two real quickly and then we can take one. Do you support equal access to health care regardless of who you are or where you live, according to race, ethnicity, gender, rural or urban?
I definitely do, and I think gender is one of the issues that I think a lot of people haven't understood for a long time, but depending on women in childbearing age, they definitely get hit up a whole lot harder than men do when it takes two people to have a baby. So I definitely
We can all clap for that. The fourth principle, this again, this story you go to three is one way to the The fourth is, do you believe that all Americans should have a choice of health care insurance coverage? Either stay with the private plan they have, get another private plan, or as is core to the HCAN campaign, have an option to get health care coverage through a public health insurance plan.
I think the key here is if you've got health insurance in our country, you keep it. Whatever we do, I don't want to dismantle any system where people are happy with the coverage that they have. Well, actually, a lot of people are happy. And so I think we've got to be sure that stays in place. About 200 million people do have health insurance coverage right now. And, well, that's what we're talking about. What I said, there's a lot of different names that you can call it. Some of us I'm looking at something that, where the state, when we have 50 states, I want to be, I'm very interested. I think our states do a pretty good job in a lot of areas. And I think when we're looking at something as big as this, then I think it's probably a good idea to have some oversight at the state level. But I want to be sure that you have the access, the affordability, the portability, that the people lose their jobs, that they're not worried about losing their health care coverage. If people decide to quit their job and go back to school, if you get laid off and you need more training, that there will be a way that people can have affordable coverage. So I think we might get caught up on some of the nuances of a word, but I think it's how that actual plan is defined is what I'm looking for to be sure that it will work for people in North Carolina.